Mental Health is the oldest community-based mental health organization in South Africa. We've been around for 108 years, and we were started by a group of volunteers who were very concerned about the plight of women with intellectual disabilities who were being abused on the streets of Cape Town. I'm Dr. Ingrid Daniels, and I'm the Chief Executive Officer at Cape Mental Health. We live in the beautiful city of Cape Town. It's one of the most beautiful cities with the mountain that guides our coming and going, but it's also a city with its shadows. And it's in those shadows that we prefer to work. I call it the shadows of Table Mountain, where we have very dire communities, communities who were dislocated and relocated because of our very sad past history, which saw groups of families and people being moved out and away from city areas. And so we have these very troubled communities with very high crime rates, very high gang warfare, very high poverty levels, communities that need a lot of support. Communities that should never be left behind, communities that should actually be prioritized, because within those communities are the people that I believe are the next generation to take my province and my country forward. It's in those shadows that we want to give hope. It's within those shadows of Table Mountain that we want to say that everyone has rights, equal citizens, equal rights, equal access, and mental health for all. We have 22 various programs or projects. And we have a team of social workers. They've specialized in mental health interventions. And these social workers also go out into the communities and they provide direct counseling services and interventions to people with intellectual disability, mental disorders, as well as people who are just needing mental health support. Then, more specifically, we have a program called the Sexual Abuse Victim Empowerment Program. It's an access to justice program. Prior to this program, children and adults, sadly, with intellectual disability were sexually abused. These cases seldom went to court because the victims were often regarded as witness unreliable, and we challenged that. We started in 1913 with this as, a concern, and way back, years later, we are still dealing with this.
What actually drew me to social work is being able to work at grassroots level in order to make social change and also to render more specifically counselling services. We work on the scopes of individual, group work, and community work interventions. So we look at an individual as being a holistic person, not just within certain spheres, if I can put it that way.
For persons with mental illnesses, we have Fountain House, and then we have what we call community-based psychosocial rehabilitation groups. It's called the Rainbow Foundation.
The Rainbow is we go to the people in the communities. We have our groups, sort of a support group, where all the people that are referred to us by the psych nurse or day hospital, if I may say, they meet on a weekly basis where they do arts, crafts, and then we're focusing on 4 life areas, which is learning, living, working, and socializing.
Hello everybody, my name is Clement Peterson and I'm diagnosed with schizophrenia. My type of illness doesn't really let me stand out, but people still somehow perceive me as different. But I know they're talking behind my back. Some people avoid me also. I don't feel nice, I don't feel right about things like that, yes. I attend the day program at Fountain House. So we just do activities during the day. And then in the afternoon, we do like a session maybe. And I'm part of C Camp. So it teaches me how to advocate for myself and other people with mental illness.
When you go to a Fountain House, you will not be able to identify who the staff member is or who the person with a lived experience is. The idea is to normalize the context of psychosocial rehabilitation to support them on their recovery journey.
I am diagnosed with intellectual disability, and sometimes it feels like I'm a burden to everyone else.
I have an intellectual disability. In the community, I feel very stigmatized. They look at you differently, as if you're not able to become independent. We are all human, and we are all living in a world where we should be loved and be accepted.
I think what needs to change is also with the families at home. That if my son comes home and says, oh, so-and-so was behaving like this and that, or, saying all the negative things, I need not to laugh with him on that subject, but to educate him and let them know that there is mental illness, that people shouldn't be laughed at.
When we do our awareness talks, we usually do it at the community hospitals, at schools. We do it at organizations, our local organizations within our area that we work in. And there are still people that would say, oh, no, thank you. I'm not interested. If they hear the word mental health, they'll and so it's really, really important to bring that awareness, to start having those conversations about mental health.
I'm a person living with schizophrenia. I live in a group home of Cape Mental Health. The more we share about mental health amongst each other, the more we will get used to the idea that it's not a taboo. Living with people who are your peers, who's living with the same illness, it can be tough because you have your mood swings and difficulties, but we understand each other. I shudder to think of people who've been alone during COVID and not being able to go out, the loneliness, and that we still had each other and,
We literally had 2 weeks from about the 15th of March until the 24th, because we went into official lockdown as of the 24th, to review. So we called emergency management meetings, and literally for 2 weeks, we looked at reorganizing the way we were providing services. We were very fortunate. The entire organization's telephony system could be migrated onto a cell phone. That meant contact with beneficiaries and contact with all our programs.
Now with lockdown, we do remote work. So we would use WhatsApp, and we use it in different ways because we have clients with intellectual disability. Some of them are not able to read, so we do voice notes. And they feel really assured that they can just drop us a voice note and they'll know, they'll have peace of mind that we will read it.
The challenge for me initially was actually being able to acknowledge and realize that face to face, I'm not going to be able to observe as intently, but in reflection and that with doing telecounseling and being able to now actively listen, I actually see it more as having been an opportunity rather than a challenge.
We now provide what we call a hybrid mental health intervention program. So it's partial facility and remote continuing. So you have these two parallel interventions happening.
When you walk in a room with our clients and you see their smile and they're so looking forward, and the feeling that I get personally when I see a smile from those people, it also brings a smile on my face as well, because we're all there, we sit, we chat about anything. They're so excited, everyone wants your attention, want to share, and even a small thing, it's an achievement to them. So it's kind of like COVID has also affected all of us because I miss those things. I can't see my members, but I communicate with them telephonically, via WhatsApp and SMSs. But I notice so many small things that I think I'll taken for granted. I even miss the hug.
We are all human, and we have all been affected in some way or the other. COVID-19, in a way, has been a leveler. hasn't it? It's allowed us to all talk about our mental health. Before COVID-19, it was closeted. People were not wanting to talk about it because it's so stigmatized. Now everybody's talking about their mental health. And we want to use this opportunity to say that our mental health is as important as our physical health. And this is the time to get support. You don't isolate. Don't feel you're alone. We want to leave no one behind in our quest to ensure that everyone, everywhere, has access to mental health care, irrespective of who you are or where you live or what your religious background is. It's not relevant. What is relevant is that we can provide the mental health support.